The question was,
what assurances can you give the Western New York region that we're meeting the need for services?
Well, we will continue to work like we have with the local government, with the elected officials, and providers from those regions throughout the state to develop priorities within the regions and to together identify areas that we need to maybe supplement or expand existing services. And if you recall, last year, that's what I committed to. And as a result, you see that, we have been able to expand services in areas that really needed them, and we will continue to do so.
Great. The $81 million you had spoken of earlier regarding prevention for drug and alcohol addiction, can you speak to that? How that funding is actually spent, where it's spent? Is that in schools? Is that out in the community? Is that a combination of both?
That's a combination. That's our total budget for all prevention. It includes work with schools. It includes funding for prevention providers, BOCES. It's all of our prevention dollars.
And can you speak to how that funding is implemented in schools, per se?
We could get you that plan if you need.
Okay, I'd like to see a breakdown of, $81 million, across the state. That seems fairly paltry, given the problems that our communities are facing across the state. Erie County alone, it's expected once all of the toxicology reports are completed, the deaths in Erie County are supposed to have doubled in 2015 from the previous year. And it's only continuing. We're over 200 deaths from opiates. So again, each community is suffering. Erie County is, the statistics back that up. The executive budget proposes $141 million to combat the heroin epidemic through these treatment and prevention efforts. And I'm hearing more and more from our hospitals and the neonatal intensive care units that babies are increasingly born with this dependency. They're going through withdrawal before they've even left the hospital. Are there existing partnerships between hospitals, maternity wards, treatment programs that can help to serve the mother?
That's a very good point, and that's an area that perhaps I need to talk to Commissioner Sucker to see how we could better work along those areas.
Yeah, I'd like to see how OASIS can better work to get out in front and be proactive with these mothers who are pregnant, who are suffering from these addictions. Is that something that you feel that your office could get involved with?
We actually are involved. We do have treatment programs throughout the state, primarily and specifically for women with kids. We have a total of, I think, maybe 22 programs throughout. These are residential programs with the target towards that population. But we'll be more than glad to see if we need to expand and work with you to do so.
Thank you, Commissioner. And are there prevention funds geared specifically toward pregnant women?
In what way?
I'm sorry?
I don't understand your question, meaning prevention?
Again, to the point I made was that we are hearing increasing amounts of babies being born already addicted to heroin and other opiates. You had talked of prevention funds being geared specifically toward women with children, and the question I asked was whether or not there are prevention funds specific to pregnant women.
Well, prevention funds are primarily for everyone. It's not for a particular age group. There's a tendency of using primary prevention for younger folks. But we do have prevention programs in the community that will work with anyone. It's not age limit. We also have treatment programs that have been trained and have people that are experts in prevention. So,
Thank you.
Thank you. Assembly?
Thank you very much. Next, Assemblyman Saladino.
Thank you, Commissioner. Appreciate you being here today, but I most importantly appreciate your commitment and dedication over the years to this issue, especially as it relates to protecting New Yorkers from heroin and opioid addictions. We've been working on this issue for quite a few years. The Assembly Minority Task Force has recently put out a report. I believe it is the best and most inclusive report to date. Have you had an opportunity to see that yet?
I did skim through it, yes.
Okay, well, we'd love for you to take a long look at that because we feel that so many of those recommendations which came out of the task force, came out of the hearings across the state, are very important. I had years ago put together my own professional task force, and those professionals, people like Dr. Christy Golden at Stony Brook, Dr. Jeffrey Reynolds, Bob Detour of South Oaks, and many other well-known and respected people, spoke to the spectrum of treatment and prevention in law enforcement. But what they told us was that the number one priority is empowering the providers instead of insurance companies to dictate inpatient treatment, the number of days, the types of services, the fact that there are many patients who need inpatient treatment and shouldn't have to fail outpatient treatment numerous times before they'll even begin to get coverage. PA 106 type of legislation, and perhaps legislation that goes further and is even better than the improved outcomes we've seen through PA 106. Would you recommend and support legislation like that? And would you tell my colleagues that this type of legislation would be one of the primary steps in making a difference by empowering the medical providers rather than letting the insurance companies decide how someone will get that treatment?
Well, Assemblyman, just to say that actually there's been a couple of items that I have mentioned in my budget this year that actually are similar, if not what the task force has been calling for, the on-call peers and the family navigators. In addition, please note that, the locator tool that was developed by OASIS last year has been implemented, does exactly what you're saying. This is a tool that they need to use, insurance companies need to use to make a determination of level of care. So we have that already in place. And to be honest with you, a lot of the Medicaid managed care companies are utilizing the tool. They actually like the tool. I think where we have a little issue is with the private insurers. And again, we're looking to really work with them on that issue.
Right to hear that the department would recommend legislation that mandates that the provider is empowered to make the decisions because they know their patients the best, because we know that currently what's going on is not solving the problem, and first and foremost, that the experts in the field tell us of the importance of embracing PA 106 type legislation. Would that be something you would recommend?
I respectfully could not comment on that. I would like to see their legislation before I could comment on that.
Fair enough, and thank you so much for all of your work. It's really making a difference. We appreciate your dedication.
Thank you.
Thank you, Senator.
Thank you. The next speaker is Senator Diane Savino.
Thank you, Senator Kruger. Good afternoon, Commissioner. First, let me thank you for the contribution to Staten Island when you recently came to devote money from the state to extend the number of beds. But I want to pick up on the comments of Assemblyman Saladino. While the state seems to be gripped in what we term the heroin abuse crisis, it's not the first drug crisis the state has faced. In fact, addiction has been around as long as mankind, one would say. 25 years ago, it was a crack epidemic. So we've been through this, but as then as now, we still have some of the same problems in providing treatment to people, and there seems to be a disjointed approach to it. If you speak to our hospitals now, particularly our emergency room directors, they'll tell you that on any given day, people are showing up in the emergency room having overdosed, And they stabilize them, and then they release them and they send them home. Many of the emergency care providers have told me that their hands feel tied because they don't have the ability to refer them to an inpatient, not even for detoxification, because the protocol says that heroin and opioids don't require an inpatient detoxification. And so to send people out home who have just overdosed and expect them to manage their addiction until they can get into an outpatient treatment program seems somewhat irrational and unreasonable. So what I think we're looking for as legislators is how do we change the law to allow the protocol to really reflect the severity of the problem. So I show up in the emergency room, I have clearly overdosed. It's been my 4th trip to the emergency room this year. And you as the emergency room doctor should be able to say that I'm a danger to myself. I cannot be expected to handle this. I need to have immediate medical treatment to stabilize me. But then most importantly, we should be investing in residential long-term treatment, not short-term rehabs. Residential long-term treatment, that's the only way we're going to combat this crisis. So what steps can we take to get to that process?
Okay, so great point, and we agree. So let me tell you what we've been doing. As part of this budget, I've also mentioned the on-call peer at ED. The idea here is to have peers working with clusters of hospitals so that when an individual goes to the emergency room that has been reversed, had an overdose reversed, that peer is contacted immediately, and that peer starts working with that individual while they're still being stabilized in the hospital, with the idea that when that individual is released, the individual is not released just back to where they came from to do it again, but rather maybe to a treatment center, to a resource center, or a crisis intervention center that we may have, to avoid that recidivism. So we have started that. We have the pilot, that it's going to be a pilot, it's in this budget, and we're very excited about it. I think that that's going to help us. I think there are other things we really could do as well, work more with perhaps, the health department to look at intake, that individuals are trained appropriately to be able to assess behavioral health, including mental health and addiction, once they come in. But so far, these are some of the things that we have put in place. And again, I'm really excited about this peer, because I think that may help, that situation.
Well, we hope so, because as I said, our emergency room directors are struggling with this, but they're seeing the same patients over and over, and they're incredibly frustrated by the fact that there's almost nothing they can do. You can't commit someone against their will, and that's a whole other conversation, but obviously what we're doing now is really not working. The fact that, people survive is almost a miracle sometimes.
Yeah. And I may just add that, there is legislation for a 48-hour hold on the books, which we plan to look at moving forward to see how we could perhaps use that legislation in situations where individuals are intoxicated, come into an emergency room, and are deemed at danger to themselves or others, and be able to assess them within that 48 hours and then ensure that they go into treatment. So that's something we're going to be looking at moving forward.
Thank you. Especially for those who are, mentally ill and chemically addicted, they're on oftentimes a cocktail of drugs, legal ones and illegal ones, and that becomes another whole host of problems. Thank you, Commissioner.
Thank you.
Thank you.
Assembly. No more assembly?
Nope.
Okay. Thank you. Thank you very much, Commissioner. I'm going to do 2 quick questions. I was following up on Senator Kennedy's question about specific drug treatment for pregnant women, and I was reading actually a national NIH study showing that treatment of pregnant women who are suffering from opioid heroin dependence can be amazingly effective at radically decreasing the problems the infant is born with. And so without treatment, these infants are ending up on average with 2 months of hospital stays, costing Medicaid over $40,000 per infant, but with the right treatment, they actually can radically decrease the harm done to the infant and the cost. So I'm wondering whether, just in follow-up, you could look into and coordinate with the Department of Health about models that apparently are taking place in Johns Hopkins and Washington, D.C., and the studies done by the National Institutes of Health, that we really can do something that helps improve the health outcomes of the baby and saves ourselves money.
And if I may add, we actually do have 2 programs that are harm reduction programs that actually do treat women that are pregnant and that may be still on methadone, trying to get over. So we do have that in place, but I would be more than glad to work with DOH to look into it further.
Because when I was reading the study quickly, being on methadone can cause the exact same problems for the fetus as being on opioid drugs. So apparently for a pregnant woman, methadone is perhaps not the right answer for a solution. And then following up on your testimony where you talked about announcing that you're going to have handheld devices to analyze synthetic drugs, and I think Senator Amador did ask some questions. Who's going to be using these? Is it emergency rooms or law enforcement? What's the purpose of them?
It's primarily law enforcement, local sheriff, law enforcement, state police.
So that when they arrest someone who seems to be acting out in certain ways, they can immediately diagnose, or the machine can allow them to diagnose what drug the person's using?
Yes.
And that would be all kinds of drugs or just synthetic drugs?
All kinds of drugs. The beauty of the machine is that it's able to pick up most of the synthetics, and that's the piece, because right now we don't have enough rapid testing, even at emergency rooms, to detect synthetics. But this machine will be able to do that.
Thank you. And the next senator, because I think we're out of assembly members, so to speak, Senator Jack Martins.
Commissioner, how are you?
Hi, good, thank you.
Good to see you again. Thank you for your testimony, and I've heard a couple of different times during your testimony today that you've mentioned that you have $6 million more this year for opiate addiction. You've mentioned that you're going to look at the possibility of a 48-hour hold for those who are recidivists when it comes to overdoses and are thankfully administered Narcan or kept alive. And you've mentioned earlier that any particular district around the state outside of New York City that you'd be more than happy to look at that district or that county to see whether more can be done. I represent a district in Nassau County. And unfortunately, we have the distinction on Long Island of having our Long Island Expressway renamed the Heroin Highway, with hundreds of young adults dying over the last few years of heroin overdose. I've also had the opportunity to work with my emergency medical responders, ambulance drivers, and personnel who tell me that they are literally responding to opiate overdoses daily. And it is a real issue. It is a recurring issue. And so when we talk about these issues in terms of things that we are going to do and look to do in the future, since this opiate addiction issue has been with us, unfortunately, for years, are we not at a point where perhaps we should reconsider how we do things and treat this more as we do an emergency and a natural disaster, and marshal resources and make sure the monies that we need are there to address this issue? And I know we have discussed here today many issues having to do with the micro of this. That is the beds, how we treat people who, women who are pregnant, and education and the like. But on a broader scale, it is your agency that is tasked with taking on this epidemic head on. And the resources that I see that have been committed to your agency don't seem to be adequate to the task. So, although we have passed legislation in the Senate and in the Assembly on both sides of the aisle to try and provide resources to deal with this epidemic. I would like to hear how we are better suited today with the budget that is being proposed than we were just a year ago with the budget that was proposed then in coming to terms with this issue. And specifically, if you can address in Nassau County or on Long Island, where those beds are, where the commitment of resources are for inpatient treatment so that those who are addicted and are looking for inpatient treatment can actually have access to it there.
Sure, thank you. So to answer, I guess, I'm not sure it's in the same order, but the question of why are we better now than before, from where I sit, we have additional treatment slots that we never had before, that now we have, including in Long Island. We have specifically young adult slots that we didn't have in Suffolk County, which we now have, which Nassau County will be able to share. And the on-site peers that we're talking about should be something that will really benefit emergency rooms, including Long Island, to address that recidivism. So we have a lot of diversified treatment programs, very innovative programs, not your traditional program, because I think, as most of you would agree, this heroin epidemic there's no right fix to it. It's not just about treatment. It's about treatment, it's about prevention, it's about recovery, it's about housing, it's about a lot of things. It's a multi-pronged effect. And frankly speaking, I feel that if you look at the programming that we have been able to develop in these past few years, we have been trying to address all those avenues. We have even started addressing the community support piece of this that never existed before. We're looking at facilitating and assisting parents and loved ones who don't know where to go, who don't know where to turn, how to navigate the system. So I guess what I'm saying is that within the budget, we are trying to address all the avenues, be as comprehensive as possible to address this epidemic.
No, I appreciate that, and I think we all understand that within this budget, that's exactly what you're doing. But is this an opportunity for us to ask I think a very important question? Shouldn't we be treating this as an emergency? If this were a natural disaster, we would be marshaling all of our resources to address a natural disaster. In the aftermath of the risk of an Ebola outbreak here in the United States and in New York State, we marshaled resources and brought all of our resources together to attack the problem at once. And we found the resources to do that. And if we treat this the same way, rather than addressing the aftermath, rather than addressing the addiction after the fact, which is important, how do we marshal our resources and treat this with the severity that it actually requires? How do we do that? And should we be calling for that? And should you be calling for that?
Well, from my perspective, I address the issue. It is a crisis. It's a public health crisis. Everybody agrees with that. And I continue to say that we will continue to address it to the best of our ability, and I believe we have within our parameters.
Commissioner, thank you.
Thank you. Senator Leroy Comrie.
Is it working? Oh, okay, yes. Thank you, Madam Chair. Good afternoon, Commissioner.
Good afternoon.
I represent South Queens, Laurelton, Cambridge Heights, St. Albans, Jamaica, parts of Belrose, including the Creedmoor campus, where we are having an extensive problem with opioid addiction that is increasing or overwhelming the staff there and their ability to provide services. The violent nature of the people that are coming there as well are creating havoc, and where we've had more injuries to the staff there as well. Can you address the ability of being able to add additional resources to the services at the Creedmoor campus to help with the violent nature of the opioid addiction that's happening there?
Well, we do run a facility at Creedmoor. We have an addiction treatment center at Creedmoor. I'm not sure that's what you're referring to, and it's co-located with the OMH facility.
Right.
And that's a rehabilitation center that we run. It's fully staffed appropriately based on the people that it serves. I have not gotten any indication that there's been a need to enhance staffing in any way, but I'll be more than glad to look into that.
If you could please look into it and get back to me. I've gotten
Absolutely.
outreach from the workers and the people that live in my community that work there, that they feel more and more unsafe with the conditions there, with the fact that many of these new addicts are coming in violent and are very disruptive to the ability of them to get any work done throughout their day there. And it's been a real problem with the staffing and the morale as a result of constantly walking into a hostile environment. So if
I
you
will
could look
look
into
into
that
that.
and get back to me, I'd appreciate
Absolutely.
it. Two other questions regarding the Department of Education, the SAPIS workers, with the increased opiate issues. The SAPIS workers in the Board of Ed there's not enough personnel to meet the need, and according to the budget, there's going to be a $2 million shortfall. I hope that we can get up to $4 million in direct funding to SAPIS to deal with the SAPIS, the substance abuse prevention intervention specialists that are placed in the schools. So hope we can get a direct line item for that to go to that in the budget this year. And I hope that can happen. It's important that if we're dealing with the increased addictions, that we can have enough personnel at the school level to try to do the intervention necessary and the prevention necessary to help young people at the source, which is the school where they're, spending most of their day. So I would hope that could happen. And then finally, OSIS changed their policy in releasing RFPs for community-based prevention, and I'm getting complaints from existing organizations that they haven't, number one, found out about the RFP, or they have to now compete in a larger pool of groups for programs, especially pre-existing programs that have been providing substance abuse treatment in the city. Is that true that the RFP process has changed?
The RFP process has not changed. It's the way it's always been. When we have an RFP, we send it out. It's on the portal, so there hasn't been a change in the process for announcing RFPs. As a matter of fact, we even now notify everybody even more with press releases and so on and so forth. So, no, the process has not changed.
Is there a new RFP that's gone out within the last year?
I'm sorry?
Is there a new RFP that has gone out for substance abuse?
There are several RFPs that have gone out for different things: clubhouses, recovery centers, expansion of treatment beds. There have been a number of RFPs that have come out, yes.
And the criteria for those RFPs have been distributed to all existing programming?
Yes, absolutely.
And all of the existing providers? And has there been a change in has there been a change in the amount of providers or any new providers? Because I've gotten reports from different providers around the city that they haven't been able to even respond to some of the new RFPs that have gone out. So I'd like to see some details on that. That's the first time I'm hearing
that, Senator, and I'd be more than glad to discuss it further with you. The intent is not to limit people's ability to respond. It's quite the contrary. We want to branch it out and open. So I'd be more than glad to look into it, and I'll be more than glad to contact your office so that you could give me a little bit more information.
Yeah, I'd like to follow up with you on it, because I know at least 3 providers in Queens that have been providing long-time services, and I'm told that other providers around the city as well have had to face new RFPs that they weren't given the technical information or ability to make a proper response to. So I'd like to look into it.
Okay.
Clearly, there are all sides to every story, but I'm getting that from more than one provider.
Okay,
Thank you.
absolutely. Thank you.